Hello everyone, my name is Dr. Tamisha Denis of Modern Smile and Implant Center, and I wanted to give you a quick illustration about how the process of ClearCorrect or Invisalign can close your gaps and spaces. So what we're going to do is we're going to use a real life example of a patient that I treated that went through the process having her gaps and spaces closed and how it worked for her. So initially when you come into the office, we will spend some time talking about what your needs and your wants are in terms of braces. So in her case, what we did is the first time she came in, we discussed the fact that she had a lot of gaps and spaces between her teeth and she wanted to close them. So you can see kind of illustrations of what her photographs look like. And we do photographs. It not only helps us to see all the nuances of what we have to do in order to fix those gaps and spaces, but it also helps us see if she is a candidate for closing her braces with ClearCorrect. So ClearCorrect, the way that we do it is you can have a free evaluation, and on that free evaluation, I will take molds or impressions and photographs and send that over to ClearCorrect, and they along with me will do a diagnostic to find out what you need. I'll show you kind of what that looks like. So we'll take molds, and this will be kind of your teeth and just a mold of it, and then we'll send that over to the laboratory. In addition to pictures, we take pictures in the front, pictures on the side to show the molars and how they come together, what the bite looks like. We take pictures from the top and pictures from the bottom. Send that over to ClearCorrect, and once they've seen everything, they put everything into what we call a treatment plan setup, which is the coolest thing. Now here is one of the representations of a treatment setup that you can find. You can see this is all in the computer from the front, left, right. You can see it from the top, from the bottom, and you see to the right it's all clicked on before. IPR, we talked about taking a little bit space between teeth. And in this illustration you can see from all those different angles the after. So see how all the gaps and spaces are closed. From the left, all gaps and spaces are closed after. Teeth are pulled back. From the right, before, after. From the upper, before, after. It's amazing. Lower, before, and after. So we get all of this information ahead of time before we even begin treatment. To the upper right, you can see it says 24 estimated steps, 1.8 millimeters estimated interproximal reduction. So we have a lot of information right before we begin. And in a treatment plan setup, what it is you will see your teeth, and you can see this right now, you can see your teeth, how they're going to move by visit. Now that is a digital version which you'll see on the computer, which I'll show you how that it works, and you'll see that, and you'll kind of see from start to finish what the timing on that is going to be. So I'm going to show you when your case arrives what it looks like. So we'll usually get it in a box like this, and it's just ClearCorrect aligners, and inside of the box there is going to be a kind of instruction sheet, so to speak, for me. And I'm going to block out the name so you don't see it. But if you can imagine this, and this has all these writings on here because we've used this one already. But if you can see, it's going to show what the appointments are, first appointment and second appointment. Sorry, first appointment and second appointment. It's also going to tell me what we need to do on that visit. Now, and I'll have closer up illustrations of this, but we'll have what we're going to do on the visit, what I have to check to make sure that everything is moving accordingly. Here's another example of a treatment setup that we can view on the computer. In this person, Elizabeth Lemon, she's not a real person, she's just an example ClearCorrect gives as an illustration, and you can see she's on step 2C. You can see this is week 15 to 16. On that appointment, we're going to verify that 2 spaces are closed where it says verified closed contacts. We're going to make sure that we make a little space between certain teeth. That's called the IPR. It'll say exactly which teeth we have to do, and we have to place those engagers, which we'll discuss in a second, on some of those teeth. But that's just some of the stuff that I see digitally to see where you are in the process of closing your gaps and spaces with ClearCorrect. And also, if there's anything that we need to do to the teeth, some of the two of the main things that we do to the teeth on a visit is called IPR, which means interproximal reduction, which with ClearCorrect, we'll take away about 0.3 of a millimeter between the teeth, because we're not pulling any teeth. So we take about 0.3 from between the teeth in order to make space for movement. The other thing that we'll place sometimes is something called an engager. And I can show you also what an engager looks like, but an engager is a button. An engager is a composite button, doesn't require any shots or needles, no drilling, and we place that button strategic points on your teeth in order to help move those teeth. Let's say a tooth is really crisscross or really out of place, it helps to move it along. So in the case of gaps or spaces, sometimes we'll have engagers, some top and some bottom, but for the most part, the appointment is really to give your trays. And I want to show you what an aligner looks like in real time. So this is just a model. This is not anybody in particular. And in this model, you can see that. You can't really even see them, which is fantastic. And this is what they look like, right? So these aligners, they come in two sets, top and bottom, and then another second set for A, B. So let's say it's your first visit. It will be visit 1, and you'll have an A, B, C, D. You'll get the A, we'll try it in, make sure everything fits. You'll snap it in. And then you will also go home with the second set, and that will be B. So I always say go on your phone and you set about 3 weeks time, and in 3 weeks time you're going to switch to B. And most people don't have any trouble. Of course, if you have any trouble, you can come back in our office and we can make any sort of adjustments. In 6 weeks you'll return and you'll get B, C, and D. And on C and D, depending on what's going on, sometimes I say, hey, how's it going? Everything fitting fine, no problems. And then we'll just snap in the new one. If we have IPR or engagers to do, we will do that. If not, we just give you a new set of trays, and I'll show you what they come in. So in this case, this is visit 2, C, and D, right? So let me just block this out for a second. But you'll see 2C, and there's a set in here, and 2D. You're going to wear them for 3 weeks at a time. Again, I also have a paper that tells me exactly what we're going to do to those visits. You can see some like red things at the bottom, and those are instructions from me, and we just make sure that everything is moving along. So depending on how long it's going to take for your case, we will kind of go through that. So I'll show you really quickly on something like this. Sorry, that's not the best. There we go. And I'll have other illustrations to do a better job of showing, but then you'll see we're in phase 2. And for this one, we have 4 phases. So it'll be 1 A, B, C, D, 2 A, B, C, D, 3 A, B, C, D, 4 A, B, C, D, and then at the last one is when we do the retainer. So if you can imagine, if you have 4 phases, that is about 3 months apiece, and depending on your scenario, we will know that from the beginning. So ClearCorrect has really come up with an awesome technology that we can follow from start to retainer. So S is start and R is retainer, to see how over the course of the different phases from phase 1A to 8A, we can see how gradually the teeth come together and all the gaps and spaces are closed. Any teeth that need to be rotated are rotated. We can see it from a top view, a bottom view, a side view. And this is something that I can share with you specifically for your specific case, so you can see how long it's going to take for your teeth to change and in what time. So at different points along the way, you'll see where you are. So it's really wonderful to see kind of how your teeth are going to change. And the way that these things work, It's just that simple. Every time you come in, small movements are coming or going closer together. So a lot of people say, Dr. Dennis, I knew it was time to come and see you because it didn't feel tight anymore. Because as the teeth move into place, they're no longer activated. And when they're no longer activated, it's time for a new one. Then when you switch, you'll feel that kind of tension again. You'll feel the tension again, and then you'll switch until we finally get your teeth to where they go. It's funny because people at home, sometimes it happens so slowly, they don't even see. And I see them, I say, whoa, your teeth have changed quite a bit. I mean, a gap that's been from here to here, and you'll see in certain cases that I'll show you, will be like, I mean, literally so much closer the next time I see them, and they don't see it because they're wearing these retainers every day. And again, with these Clear Correct retainers, you're really going to be taking them off, brushing your teeth, eating, and putting them back in. So again, it comes in these containers with instruction sheets in there. Those are for me so that we can say, what are we doing today? Are we going to be placing some engagers? No, sorry, that's not coming out very well. Okay, right over here. Those blue points are the engagers that we're going to place, and you see check marks just because we've already done it, until gradually we can close the gap spaces between your teeth, and they come in these handy little kits right over here. Okay, so that's how Clear Correct works. It's fantastic. I get great results, and in I think a very reasonable amount of time, you can get your gaps and spaces closed. You can have crowded teeth fixed, and it really just fits into your lifestyle. Most of the patients I see, they've had braces before, and they're not really interested in bonded brackets and wires, and they like something clear, removable, and like I said, you can hardly see it. You can hardly see it, and depending on your hygiene, it's even better than that. Right? So it's very comfortable. I usually go out to a restaurant, I can tell who's wearing it. That's just because I'm a dentist, but most people can't tell at all. Anyways, thank you for watching, and you'll please make sure to check out some of our other videos about Clear Correct, about dental implants. We have a lot of information for you. Educated patients are the best patients. Do your research, and see you next time.